ओम थम धन्वंतरे नमः। यागादिरोगान् सततानुशक्तान् अशेषकायान् प्रस्तान् शेषान् औत्सुक्यमोहानितान् च घ्राणान् योगपूर्ववैद्याय नमोस्तस्मै। Let me share. Topic is chronic kidney disease, Ayurveda management. So, because of the diseases like diabetes mellitus, hypertension, and repeated urinary tract infections, the incidence of chronic kidney disease has raised. Chronic kidney disease is defined as chronic and progressive loss of renal function, which is irreversible and is characterized by increased blood urine nitrogen and the symptoms of viremia. The causes, when we consider the causes, there are four pathologies. That is toxic, infective, vascular, and another is obstructive. Infective causes are repeated urinary tract infections and pyelonephritis that leads to chronic glomerulonephritis and chronic kidney disease. Toxic causes the use of nephrotoxic drugs like non-steroidal anti-inflammatory drugs, paracetamol, etc. The repeated ingestion of these drugs can lead to damage of the glomeruli and chronic kidney disease. Another cause is vascular, systemic hypertension, persistent systemic hypertension, and renal thrombosis. This can lead to the damage of the renal tissue and can cause chronic kidney disease. Last one is the obstructive causes. Obstructive pathologies like benign prostatic hyperplasia, the bladder neck obstruction by impacted stone or tumors or urethral strictures can cause the obstruction to the urinary flow and can cause hydronephrosis and renal failure. Here you can see the transverse section of the renal parenchyma, okay, renal tissue. You can see the inflammatory cells and the sclerosis of the glomeruli. So this is also under microscope. The renal tissue is seen. The cortex is seen like this. Not differentiate between cortex and medulla. Differentiation between cortex and medulla is lost. Histology, histopathology of the kidney. So the when we say the disease stages, there are various stages. In the first stage, there will be 10% of glomerular filtration rate is lost, and in second stage, 75% of glomerular function is restorated. That 25% is lost. Third stage where 40% of renal function, only 60% of renal function is normal. In the next stage, is 90% of renal function is lost, or 10% of renal filtration rate is seen. Coming to the lung transaction, you can see the difference, healthy nuts. So coming to the clinical features of chronic kidney disease are there are in each system is affected. Symptoms: gastrointestinal tract like nausea, vomiting, coffee ground vomiting, melena, and also Respiratory symptoms like cough, expectoration, no, dyspnea, and these symptoms are seen. In the nervous system, there can be symptoms like altered sensorium, stupor, delirium, vicoma, coma, that can occur. Pertaining to the skin, there can be itching all over the body. Uremic frost is the color of the skin is changed. Light is like pink. Pertaining to the reproductive system, there may be impotency, and there can be amenorrhea and sterility. Pertaining to the bones, there can be because of overactivity of the parathyroid hormone, then demineralization of the bones, leading to soft and cystic fibrosa, osteitis fibrosistica. Cystic fibrosis degeneration in the bones. Bone become soft and fragile. Pertaining to the cardiovascular system, because of sodium water retention and overload, volume overload, there can be symptoms of left ventricular failure, pulmonary edema. Symptoms like inability to walk, and paroxysmal nocturnal dyspnea, surface expectoration, and fatigue. These are seen. So, then there will be symptoms in almost all systems. See, hypertension will be there. Severe hypertension is seen. Related to the immune system, oliguria, anuria, polyuria, etc. Depending upon the underlying pathology and the state and stage of the disease. This is a section of the kidney. You can see the tubules. There is also so in the changes. Murders may be also seen. There may be degenerative things. You can see the glomeruli. There is degenerative. So the differentiation is a part of animal. The electromagnetic. Sclerosis. Pathologies in chronic. From the top you can see there changes. Coming to the treatment. So, treatment of the disease as well as its complications. So, we have to give diuretics, emetinics, hypotensives, and rasayana drugs, and nephroprotectives, and also we have to give appetizers, dipanapachana. So, sometimes first reason is a variation. So, these medicines are given. Purnanava di Mandura is a Purnanava. Urhavia, which is a diuretic drug. Can give Purnanava di Mandura. Can also give Varunadi Kvata, Pranapanchamola Kashaya, Varunashikri Kashaya, and Bhukshara Churna, Bhukshuradi, Gugulu. This you can give. There will be increase in potassium content in the blood. This hyperkalemia is the common complication of CK. We have to avoid the fruits which are containing high potassium content, like orange, musumbi, nimbu, banana, underground water, these all contain high potassium content. We have to do diuretics, we have to give hematinins because iron deficiency anemia is common finding in case of CK. We can give Noise Aloha, Manavadi Mandura, Noise Churna, Akshavalena, and Rakshati Kashaya, Datri Loha, Triphala Mandura. We have to give hypotensives like Sarpagandhavati, Ratamamsa Churna, Agarata. If it is not controlled, we have to use modern medicines. Some factors given. And if the left ventricular failure is there, we have to go diuretics, cardiotonics, and expectorants, epileptics, and bronchodilators. That is, if there is pulmonary edema, same medication is given. If there is cerebral symptoms, encephalic symptoms, we have to treat the same. So, in case where there is a skin itching is there, uranic frost is there, we can use Arivadasava, Nanasava, Kashaya. So, like that, depending upon the underlying pathology and also comorbid situations and complications, we have treat cases of chronic kidney disease. This is the Gokshira, Rebelis terrestris. This is Varuna, Kateva, Narvala, Parkisus. This is Pashana Veda, Erva, Renata, Kashaya or Churna. This is Kulatta. That is, Kulatta Yusha can be used. Very useful in case of pathology. The banana, that should be avoided because high content of potassium. But this is the orange, it is high potassium content. We have to avoid it. This is also orange. This is narikal, tender coconut water. That is usually not given in renal cases, but in CKD, not be given because it contains high potassium content. So, this I have discussed about the definition and clinical features and investigations and diagnosis. Diagnosis, that is renal function test is there, also ultrasound. Then complications, positive complications, principle of treatment, principle of complications. Okay. Thank you for your patience.